Hello, my name is Amanda and I'm one of the community nursery nurses with the Sutton Health Visiting team. We would like to welcome you to our common illness video and hope you find the advice useful when yourself, your children or any family member are unwell. There are many common illnesses that babies, children and adults get, especially in the winter months. These will include coughs, colds, ear infections, high temperatures and sickness and diarrhoea. It can be normal for babies and children to have high temperature after vaccinations. If your child is eating and drinking normally, passing urine and their bowels are opening as usual, and they're generally behaving as usual, then they probably are not really that unwell and is something that you can easily treat yourself at home. If your baby is in pain, you can give them some paracetamol or ibuprofen if they are over 3 months old. Please visit the nhs.uk website for all the latest advice. If your child does not respond or has worsening symptoms to any illness, which may include a high temperature, and paracetamol or ibuprofen does not reduce their temperature significantly, or for any reason you remain concerned about your child, then please contact your GP, 111 or your local A&E department in an emergency. Did you know that it's common for children to get up to 8 colds per year? And as their immunity builds, they will get fewer colds. Saline drops can help to ease the blocked nose. Children may also develop an ear infection alongside a cold. Indications that your child has an earache may include pulling or rubbing their ear, not feeding very well, crying or generally being unsettled. Ear infections are usually caused by a virus and do not require antibiotics and will get better on their own. Do not use earbuds or put oil down the ear or use eardrops unless advised to by your GP. You can give your child paracetamol or ibuprofen if required. Your child may develop signs of the flu, which can be similar to a cold, but they may develop a sudden high temperature, be less active and not want to feed or eat. Offer plenty of fluids and give them plenty of rest. If your child is over 2 years old, we would highly recommend that they have the flu nasal spray vaccination. Contact your GP who can advise you where you can have this done. If your child has a high temperature, this is the natural way of their body fighting infections like coughs and colds. A normal temperature in babies and children is 36.4 degrees and a high temperature would be 38 degrees or more. Sickness and diarrhoea are common in babies, children and adults. Vomiting would usually last for 1 to 2 days and diarrhoea generally 5 to 7 days. You can generally treat yourself at home with the following advice. Drink lots of fluids. Sipping will help if you are being sick. Feed your baby as normal. If they are being sick, offer them small amounts more frequently. Stay at home and get plenty of rest. Offer your child food when they ask for it. Remember that sickness and diarrhoea can spread easily, so it's very important to wash your hands frequently. Wash bedding, towels, etc. that have been in contact with vomit or diarrhoea. Make sure you wash them on a hot wash. Clean all toys, surfaces, toilets, etc. every day. When your baby starts to teeth, which is normally when they are about 4 months old, but they can start to teeth earlier, they may be in pain. They may become unsettled and upset. They may develop a high temperature and refuse to feed. Others may show no signs at all. You can help relieve the pain by offering your baby a teething ring. This could be put in the fridge to cool down. Do not put it in the freezer and never tie a teething ring around your baby's neck. This is a choking hazard. If your baby or child or any member of your household is showing signs of COVID, please follow the current government guidelines.
My name is Reena Barai and I'm community pharmacist based at SG Barai Pharmacy in Sutton. It can be very difficult when you've got children who are unwell to know where to go and where to take them. Community pharmacies are everywhere. You'll find us in your local parade of shops, you'll find us on the high streets and you'll find us in your supermarkets. Many of them open 6 days, some of them 7 days a week. And within every pharmacy, there is always a pharmacist that's trained to help you to help your child. Pharmacists go to university for 5 years and are experts in medicines and minor illnesses. Often it can be a little bit daunting when your children are unwell and you're not sure whether it's just something simple and minor or if it's something more serious. Going to your pharmacy is often a really good first port of call if you're worried about your child. Pharmacists are also able to possibly refer you to your GP if they're worried or concerned about some of the symptoms you're describing. We may also tell you to go to A&E if we're extremely concerned and we feel that it's something that needs to be seen quite urgently. A pharmacy is not just a place to get advice. Pharmacists are trained in giving you advice on medication that you may be prescribed. We dispense medication. We can also provide the morning after pill, many sexual health testing screening kits as well. And also if you're travelling or going abroad, we can give you advice on what you may need for travelling abroad safely. One of the big advantages of visiting your local pharmacy is that you don't need an appointment. You can just walk in to see a pharmacist anywhere. If you're not sure where your local pharmacy is, you can visit the NHS website, put in your postcode and look for Find a Pharmacy, and you'll be able to find where there's a pharmacy open near you and the opening times as well.
Hi, my name is Dr. Baskaran, GP partner at the James Oridan Medical Centre. Over the years, we've developed our ways of managing conditions, treating our patients in the very community-based setting in pharmacies, and now we're working closer together with primary care and secondary care to make sure that we can provide the best care we can in Sutton. So when we talk about conditions that can be managed in the community and general practice, we're finding ways where we can try and improve the care of our patients. We're now using different methods of communication, telephones, videos, as well as pictures. This can be a wonderful way to treat patients because not only can we pick up or what we call spot diagnosis straight away from the image, but if we do need further referrals or help with our colleagues, we can pass these images on for advice. So what we normally advise is simple things like rashes that have been there for a little while. Do see your friendly pharmacist as soon as you can to see if they can help. So if you are worried about your child and you've tried all the basic methods and you've spoken to your pharmacist without any success, trying over-the-counter medications, please do contact us. We're here to help. If there is any concerns you have further to that where you think this is an emergency, please do contact the emergency services as soon as possible. However, we are there to help and we want to do everything we can in the first instance. So if there are any concerns, do call up your GP. We together will try and make that decision to make it more comfortable for you to decide whether we can manage this in primary care in the community or we can get you the help that you need in the A&E department. Remember, there are still other viruses out there, and just because COVID has taken over a lot of it, there is still a very, very high risk of getting measles, getting rubella and mumps. Routine vaccinations and seeing us routine for development issues is still a big concern for us. So please do make the effort to book in with your GP practice and see one of our nurses to have a discussion about it if you do have any concerns. We know that a lot of these conditions, they do drop your immune system if you pick up a virus, and therefore it puts you at even higher risk of picking up COVID. So if we can protect our children as best as we can by immunising them at the right stages, we can hopefully ensure that we don't have a backlog for the future and make sure all of our kids remain healthy.
I'm Dr. Daniel Langer, Consultant Paediatrician and Joint Clinical Lead for the Paediatric Emergency Department at Epsom and St Helier Hospitals. If you need to bring your child to our Paediatric Emergency Department on the ground floor at St Helier Hospital, you will be asked to register at the Adult Emergency Department reception, and then you'll walk round to the Paediatric Emergency Department. You will be seen first by one of our very experienced streamer nurses, who will assess your child and prioritise them in order of seriousness. It's not unusual to wait a while to be seen in the ED, as we are also caring for a large number of children. We need to keep our emergency department free for any seriously ill children being brought by ambulance and to avoid you having unnecessary waits in the emergency department. Please only attend the emergency department if you feel your child needs emergency medical attention. You can book a GP appointment both during the day and in the evenings, and on weekends as well, using our GP hub appointments. And you can contact 111 if you need advice and your GP is closed. You should call 999 immediately if your child has difficulty in breathing. Signs that a baby needs help include a baby who is too breathless to feed, is making a grunting noise or bobbing their head up and down, or breathing too fast persistently. If they appear blue around the tongue or lips, or if their muscles between or under their rib cage are sucking inwards, or if they are less responsive or very lethargic and drowsy, then seek help from 999. An older child who is unable to talk in full sentences without being breathless, breathing too fast persistently, should be brought to PEDS immediately or call 999. If there is a wheezy sound associated with the above symptoms, then they should seek urgent help as they need a trial of medicine to open their airways. Bronchiolitis and croup are common in children and can cause a wheezing noise and inability to feed. Bronchiolitis tends to get worse on days 3 to 5 before it improves, but the cough can remain for weeks. You only need to bring your child to PEDS if you are really concerned about their breathing. You should bring your child to the Paediatric Emergency Department for assessment if any of the following apply. If they become unconscious and do not recover after 5 minutes. If they have a seizure lasting more than 5 minutes. If they have more than 3 episodes in one day. If they become confused or unaware of their surroundings for longer than 30 minutes. If they develop weaknesses in their arms or legs or start losing their balance. If they develop problems with their eyesight. If they collapse during exercise or strenuous activity. For an unconscious child or fitting child at home, move any sharp objects out of the way. Never put your fingers in the child's mouth, and place the child onto the side in the recovery position. We recommend learning some basic first aid which can help with confidence and accident prevention around the home. There are many courses out there to choose from. So how do we know if a child requires emergency treatment? Any burns, scalds, poisoning or drowning of a child at any age should be brought to PEDS ED for assessment. Most bruises resolve within a few weeks and don't cause any problem. If your child has an accident that results in severe pain that is not controlled by common pain relief medicines, such as ibuprofen or paracetamol, then they should come and see us to manage the pain, as well as to rule out a more serious injury. If an arm or leg looks like it isn't straight, has a large bump, or the child cannot use part or all of their arm or leg despite pain relief, then come to see us. They may require an X-ray. If there is significant bleeding, such as from an open wound which doesn't stop from applying pressure and dressing the wound, or the wound is too deep or wide to easily dress it at home, or there is a foreign body like a nail or a stone, you should come to see us so that we can assess it, and it may need glue or stitches to help it heal. You should always bring your child to the Paediatric Emergency Department if they have been part of a significant event, such as a car accident or a fall from a significant height, as there may be injuries that are masked. You may also notice your child not using their arm or leg, but you are not aware of any injury happening to them. If they don't start using their limb normally again after 2 to 3 days, then bring them to us for assessment. Most head injuries don't need to be checked by the emergency department unless any of the following apply, which could indicate a more serious injury and or concussion. Any child under 1 year of age should be brought to us for assessment. If they vomit twice or more after the injury, if they become confused or unaware of their surroundings, lose consciousness, become drowsy or difficult to wake, if they have a convulsion or a fit, if they develop difficulty speaking or understanding what you are saying, if they develop weakness in their arms and legs or start losing their balance, if they develop problems with their eyesight, if you notice clear fluid coming out of their nose or their ears, if they do not wake for feeds or they cry constantly and cannot be settled. You do not have to continuously wake your child up to check they are okay. For sprains and strains, in the first 24 hours, elevate the affected limb. Put an ice pack around the painful area and rest it. After 24 hours, then try to move the limb, using pain relief as necessary, such as ibuprofen, as it is a good anti-inflammatory medicine to help with these sorts of injuries. We would like to see any child who has suffered a burn or a scald. Run it under cold water for at least 10 to 15 minutes before coming to see us in the ED. It's vital to remove the heat source by doing this. Perhaps stand them in the shower. If the burn or scald covers a large area or the damage is deep into the skin, cover the area with a sterile dressing or non-fluffy material like cling film or a clean plastic bag and come and see us. Children can be cared for at home with COVID-19 and other common viral illnesses. If your child displays any concerning symptoms with their breathing or you think they are dehydrated, then please bring them into PEDS for assessment. The great news is in children, we very, very rarely see serious concerns with regarding to COVID-19. The majority of COVID-19 symptoms in children are a cough, a fever, cold-like symptoms, sometimes an upset tummy. And this should be treated just the same as for other common viruses. They can mostly be managed at home by providing pain relief, paracetamol or ibuprofen to control the temperature, fluids for hydration, and observation to make sure that they don't deteriorate, in which case they should come to us for a further assessment. Babies and children get many rashes over the course of their childhood. The vast majority are not serious. You should seek advice from the Paediatric Emergency Department only if a rash does not disappear under pressure. This is called a non-blanching rash. An easy way to check for this is to take a clear glass or a tumbler and then put it over the rash and roll with pressure over the skin. You should also come to see us if it's spreading quickly across the body or if there are signs of swelling. With regards to allergy, you may notice hives spreading across the body. This rash may be in the form of many different shapes and be very itchy. If you notice this, try taking an antihistamine, which you can get from over the counter at any pharmacy. If there are signs of swelling of the airway, such as you hear a wheeze, or lip or tongue swelling, or there is associated abdominal pain with diarrhea, or if you are suspecting a severe allergic reaction, call 999. We are actually seeing a new phenomenon in some children with purple rashes on their palms and their soles with COVID infection. This is known as COVID toes. This may last a while, but can be cared for at home, and there is no need to bring the child to Peds ED for this alone. D&V is extremely common in young children, and often due to a viral infection called gastroenteritis, and does not need to be seen in our Peds ED unless your child is showing signs of dehydration. Signs of dehydration include not passing urine for 12 hours, being drowsy or irritable, having sunken eyes or very dry mucous membranes, which are your lips and tongue. Abdominal pain is common, but your child should attend the ED for assessment if they are in severe pain despite pain relief, when they are moving around or going over bumps in a car, or if they have green-stained vomit, blood-stained vomit, if there is significant abdominal swelling, and in boys if there is testicular pain or swelling. At home, try oral rehydration solution from your pharmacist. Drink little and often. If you are breastfeeding, this should be encouraged still. Avoid high sugar drinks such as fruit juices, Coke, squashes. And you may wish to avoid dairy, as this can make, in some, diarrhea worse. Diarrhea can often continue after the infection has gone, but this is nothing to worry about. It will settle down in a few weeks. For a baby under 3 months old, any temperature of 38 degrees Celsius or above should be assessed by a GP or in the Peds ED, unless it's an expected temperature, for example after their immunisations or vaccinations. For anyone over 3 months old, a high temperature is over 38 degrees Celsius by definition, and in itself is not dangerous. It's the body's natural response to an infection and actually helps the body stimulate an immune response. The height of a fever also does not determine the severity of infection. Children can sometimes have a convulsion or a fit with a very high temperature. These cannot be prevented. You don't need to bring your child to Peds ED with a high temperature. If, however, your child has confusion, drowsiness, difficulty breathing, sensitivity to light, they look really pale, they look mottled, or they feel abnormally cold to touch, or, as mentioned, has a rash that doesn't disappear on pressure using a glass or tumbler, call 999. If your child has any serious signs related to breathing or a seizure, bring them urgently to Peds ED for assessment. And if a fever doesn't respond to the medicines, it does not mean it's a more serious illness. Some infections just don't. You do not have to give paracetamol or ibuprofen for a temperature or a fever, but you may choose to because it makes your child feel more comfortable. There is also no need to hold off giving your baby or child paracetamol or ibuprofen before bringing them to see us or to see a GP. The doctor will still be able to assess them and will take into account any painkillers that they have had. There can often be a significant wait in our departments, and your child may feel more comfortable having had paracetamol or ibuprofen before they arrive. I hope this video has been informative and useful and will help you make a better informed decision about which route to take when your child is unwell. For more information, please visit the link provided.